Hello and welcome to the Jewish Rehabilitation Hospital information session about understanding stroke. This is a part one of a two-part presentation on stroke. For you to understand what is a stroke, we need to start with the brain. What is the brain made up of, the different parts of the brain, and what they are responsible for? What is a stroke, and the different types of stroke? We will cover the warning signs of a stroke so that you are able to act fast. Preventing stroke and understanding the risk factors for stroke will be covered in part 2 of this presentation. We will conclude this video with why rehab is so important and how you can play an active role in your recovery. The medical term for stroke is cerebral vascular accident, or CVA. It means that there was an accident or injury to the blood vessels in the brain. As you can see in this picture, the brain is divided into different lobes or sections. Each of these lobes are responsible for different functions in our body, and depending on where the stroke is located, that will affect those functions. This will be later discussed in further detail in this presentation. A stroke is diagnosed by performing a head scan or an MRI of the brain, multiple neurological exams performed by a neurologist, nurse, occupational therapist, speech therapist, and physiotherapist. These are the main arteries responsible for supplying blood flow to the brain. We have the common carotid arteries located in the right and left side of the neck area. We have the vertebral arteries in the back of the neck on both the right and left side as well. And these branch off into different arteries inside the brain. There is the anterior cerebral artery, which is located in the front of the brain, the middle cerebral arteries, which are located in the middle, and the posterior cerebral arteries, which are located in the back. In order for you to visualize how the blood flows through the arteries in the brain, let's use a tree as an example. The trunk of the tree can be the carotid artery in the neck. See how it branches off into many main, secondary, and minor branches in many different directions? Picture blood flowing through the trunk and into these branches to help supply the brain with the blood, nutrients, and oxygen that it needs. Imagine a break in one of the main big branches of the tree. All the secondary and minor branches will die off. That is what happens when there is an accident in one of the main arteries of the brain. The area of the brain that artery is responsible for to provide the blood, oxygen, and nutrients it needs to survive is cut off, and that large section of the brain dies. If one of the smaller branches of the arteries are injured, then there is a smaller section of the brain that dies. This is what differentiates between a severe stroke and a mild stroke. Because the brain is divided into two halves, the carotid arteries that we talked about are located on both sides of our neck so that each half brain gets the blood supply it needs. But what happens if there is a blockage in the carotid artery? Does one side of the brain get no blood at all? Well, located in the middle of the brain, connecting the blood supply of both sides of the brain, there is an intricate web of arteries called the circle of Willis. So that in the event that one of the carotid arteries gets blocked or partially blocked, this circle of Willis ensures that blood flow to the brain gets to the other side. There are two different types of strokes. One is ischemic stroke. What that means is that the stroke was caused by a blood clot that has blocked the artery and stopped blood flow to the brain. 80% of all strokes are ischemic strokes. There are two types of ischemic stroke, thrombotic or embolic. What is the difference of the two? Take a look at the next slide. A thrombotic ischemic stroke is caused by a blood clot that develops in the blood vessel inside the brain. An embolic ischemic stroke is caused by a blood clot or plaque debris that has developed elsewhere in the body, has broken off, and travels to one of the blood vessels in the brain through the bloodstream. An ischemic stroke can also be caused by a dissection of the carotid or vertebral artery. This means that the inner wall of the artery was torn away or detached from the wall, causing a significant decrease in the blood flow to the brain or total occlusion of the blood flow. It can also be caused by a blood clot disorder called hypercoagulation disorder. The other type of stroke is hemorrhagic stroke. What is an hemorrhagic stroke? An hemorrhagic stroke occurs when a blood vessel that supplies the brain ruptures and bleeds. And when an artery bleeds into the brain cells and tissues do not get the oxygen and nutrients it needs. The pressure builds up in the surrounding area, causing irritation and swelling, which leads to further brain damage. Hemorrhagic strokes are divided into two main categories. Intracerebral hemorrhage, which means the bleeding is from the blood vessels within the brain, or subarachnoid hemorrhage, which means the bleeding happens in the subarachnoid space, which is the space between the brain and the membranes that cover the brain. Hemorrhagic stroke can be caused by aneurysms or AVM, arteriovenous malformations. An aneurysm is a weakened, ballooned area on an artery wall and has a risk for rupturing. They can be congenital, which means they can be present at birth, or may develop later in life due to high blood pressure or atherosclerosis. An AVM is a congenital disorder, which means it was present at birth, and it is made up of an abnormal tanglement of arteries and veins. When we talk about stroke, we need to talk about TIAs, or transient ischemic attacks. Some might call it a mini stroke, but it's really a warning sign, a major warning sign. A TIA is a temporary blockage of blood flow to the brain. Since it doesn't cause permanent damage, it's often ignored. But this is a big mistake. TIAs may signal a full-blown stroke ahead. When you first notice symptoms, you must get help immediately and call 911, as it is a medical emergency. The brain is divided in two parts, the left side, called the left hemisphere, and the right side, the right hemisphere. The left side of the brain controls the right side of the body, and the right side of the brain controls the left side of the body. The left side of the brain controls the movement on the right side of the body. It is responsible for critical thinking, logical thinking, reasoning. It is responsible for language, People who are dominant on this side of the brain are very good in science and math. It is responsible for our writing and our number skills. When we have a stroke on the left side of the brain, you can have a weakening or paralysis on the right side of the body. You will have speech and language issues. You can be very slow, very cautious in your behavior. You will have difficulty organizing tasks. You can have facial weakness or problems with swallowing and memory loss. The right side of the brain controls movement to the left side of the body. It is where our creativity and imagination comes from, our intuition, our insight, our music awareness and art awareness, and spatial recognition. When there is a right brain stroke, you may have weakness or paralysis on the left side of the body, visual problems. You're very quick, impulsive, very curious in your behavior. You can make poor decisions because of your inability to judge distance or speed or positions of objects. You may have also facial weakness and problems with swallowing and memory loss. Each hemisphere or each side of the brain are divided into different lobes, and each of these lobes are responsible for different functions. The frontal lobe is responsible for coordinating movements such as walking, reaching for objects. It is responsible for assessing consequences of our actions, assessing the similarities and differences between two objects, forming and retaining long-term memory. It is responsible for language, speaking, our emotional expression, and regulation. It is responsible for our personality, our motivation, and attention. So when there is a stroke located in the frontal lobe, one may have the inability to engage in decision making, difficulty with planning and executing a function or activity, a decreased attention span, loss of memory, sudden or dramatic changes in personality, changes in emotions such as signs of depression and anxiety, difficulty understanding social cues or relating to the emotions of others and showing empathy, changes in motor skills, spatial reasoning abilities, and language issues. The parietal lobe is home to the brain's primary sensory area. It is vital for the management of taste, hearing, sight, touch, and smell. The parietal lobe enables you to localize touch. When you touch any object with any part of your body, your parietal lobe enables you to feel that sensation at the site of the touch and not say all over your body. It helps integrate sensory information. It helps with visual spatial navigation and reasoning. This means you're able to read a map, follow directions, prevent yourself from tripping over an unexpected obstacle. Your ability to determine where your body is in space. For example, touching your finger to your nose without the assistance of a mirror is the function of a parietal lobe. Assessing numerical relationships, being able to calculate. Assessing size, shape, and orientation of objects in space. Coordinating hand, arm, and eye motions. Processing language and coordinating attention. The temporal lobe plays a key role in hearing. The role includes being able to perceive sounds, assign meaning to the sounds, and remembering sounds. It is responsible for long-term memories, interpreting the meaning of what you are seeing, including recognizing objects. It's not just enough to see an object, but for vision to be useful, you must also understand what it is you are seeing. So the temporal lobe helps assign meaning to your sights that you see every day. Without that lobe, you would not be able to recognize faces or read body language. It is also responsible for the production of speech and being able to understand speech and give meaning to that language. Without the temporal lobe, you would not be able to name objects, remember verbal exchanges, or recognize language. It is also responsible for controlling our appetite and thirst. The occipital lobe is responsible for vision, helping you map out the world, determining color, assessing distance, size, and depth, being able to identify familiar faces and objects, and being able to recall those faces and objects later on. It's also responsible for interpreting what you see. Damage to the occipital lobe can cause diplopia, or double vision, or hemianopsia. Hemianopsia is blindness or loss of vision in half the visual field. The cerebellum is located at the back and bottom of the brain, behind the brain stem. It has several functions. It helps maintain our balance. The cerebellum has special sensors that detect shifts in balance and movement. It sends signals to the body to adjust and move. It is responsible for coordinating movement. Most body movements require the coordination of multiple muscle groups, so the cerebellum tells the muscles to move so that the body can move smoothly. It is responsible for the coordination of eye movements. It is responsible for motor learning, which means it helps the body to learn movements that require practice and fine-tuning. For example, the cerebellum plays a role in learning to ride a bike or play a musical instrument. The cerebellum and the brainstem work together to manage vital functions such as breathing, circulation, meaning heart rate, sleeping, digestion, and swallowing. Could you recognize the signs of a stroke or a TIA? It is important to learn the signs of a stroke. Is your face drooping? Are you able to raise both arms and keep them raised? Is your speech slurred or jumbled? Then it is time to call 911 right away. You must act fast, because the quicker you act, the more of the person you save. If you thought you were having a stroke, would you A, phone your doctor and make an appointment as soon as possible? B, lie down and rest until the symptoms went away, especially if they were brief? Or C, call 911? The answer is call 911. This little true or false exercise is to help you understand the signs and symptoms of a stroke. If you feel a tightness or pressure in your chest, that is not a stroke. It could be a heart attack. If you get a sudden, unusual, or severe headache, that can be a sign of a stroke. If you are paralyzed or weak on one side of your body, that could be a sign of a stroke. If you have difficulty speaking or understanding speech, that is a sign of a stroke. Unexplained fever or elevated temperature, that is not a sign of a stroke, rather may be the flu. A sudden dizziness, trouble walking, loss of balance or coordination, that is a sign of a stroke. If you feel numbness or weakness in your face, arm, or leg, especially on one side, that is a sign of a stroke. If you have difficulty breathing or have chest pain, that is not a sign of a stroke. That could be a heart attack. If you are experiencing double vision or loss of vision on one side, that is a sign of a stroke. It is important to react immediately when experiencing one or more of the symptoms of stroke. There is a medication called TPA, tissue plasminogen activator, and it has been effective for people with an ischemic stroke as long as it is received intravenously within 4 hours of the onset of symptoms. It works by trying to dissolve the blood clot and restore blood flow to the brain. This allows the brain to remain healthy before stroke damage can occur. Endovascular thrombectomy is also used for the treatment of ischemic stroke. The doctor will insert a thin tube through an artery in the patient's groin, guiding it with X-ray imaging through blood vessels to the brain, and there retrieving and removing the clot. But this can only be done within a 6-hour window from the onset of the stroke symptoms. Why is rehabilitation important? It is the most important factor for stimulating the neuroplasticity process in post-stroke patients. What is neuroplasticity? It is basically the ability of the brain to rewire or reorganize itself after injury. How does neuroplasticity work? Neuroplasticity works when the brain cells regenerate, reestablish, and rearrange neural connections in response to the damage inflicted by a stroke. The brain can work around the dead cells and attempt to construct other neural pathways to compensate for the damage. This is where rehabilitation comes in. It sparks neuroplasticity. It encourages the brain to correct and create those synapses. This is why it is so important to begin the rehabilitation process shortly after a stroke occurs. The damage inflicted by a stroke is unique to every patient, and so is the recovery process. It is not a one-size-fits-all proposition. The brain uses 100 trillion neural connections or pathways to retrieve and store information. When a stroke occurs, any combination of those 100 trillion connections could be impacted. They need assistance and stimulation to change or adapt. This is where therapists and you play a vital role. A variety of exercises, movements, activation, stimulation can be used to cue the brain to rewire and adapt, creating new neural pathways that can work around any brain damage and alleviate some of your deficits. While the brain may adapt on its own to stroke-related cell death, on some level it must be stimulated with specific cues and exercises to adapt and repair effectively. And the best way to stimulate the brain and activate the neuroplasticity is through repetition. Heavy repetition of certain movements or activities will retrain the brain and force it to create new neural connections and pathways. The harder a stroke patient works to retrain the brain, the more likely a positive outcome. Here are some activities that you can do on a daily basis to help develop neuroplasticity. Washing and dressing. Some cognitive activities like word puzzles, Sudoku, word finding puzzles, calculations. Speaking and communicating as often as you can, no matter how difficult. Walking, mobilizing, transferring. Playing games that require repetitive movements are all examples that can help you develop neuroplasticity. Thank you for listening. For any questions, please refer to any member of your treating team.